I am Dr. Jayanta Kr Saha, Senior Consultant Plastic Surgeon in Kolkata. I am practicing on this discipline of plastic and reconstructive surgery and aesthetic surgery for last more than 15 years in Kolkata. Hair transplant is a technique by which we can implant or transplant our hair from a hairy area to non-hairy area. Like those patients who are baldy, mostly in the male, we can see the frontoparietal recession, the upper part of the front side, there is baldness. So we get the hairs from the back of the scalp and we take a strip and we make it divided into different small parts, that is called follicular unit, and we transplant in the baldy area. But in the female, you will find the baldness is always diffuse in variety, where the patient will parting area and there you will find. And nowadays female male type of pattern of baldness is also seen. So the donor site of the hair transplant is from the back and it is transplanted on the part where hair is very little sparse. The condition of hair transplantation is mostly whatever we find is androgenic alopecia or our hereditary baldness. Those parts, the patient comes to you, they are very much tense, panic, because of they look more older, they are not accepted by the society, they are not accepted by their profession. Suppose those who used to sit in the front desk of a restaurant or they are in a meeting place, so they always come to meet you for the hair transplantation. The hair transplantation is the only scientific technique by which you can recover from baldness. There are many techniques in hair transplantation. Initially, when it started, they used to take the strip method of the hair transplantation, like they take a strip of the scalp along with the hair and then they stitch it on the bald area. But nowadays, again, it is changing. Now there is mostly two techniques. One is FUT, one is FUE, follicular unit technique and follicular unit extraction. So FUT means you take a strip from the back and you make small follicles under the microscope or your corneal loop magnification, and one follicle might have or graft might have 2 or 3 follicles. The more follicle hairs will be in one follicle, the results will be good. So you make it one small graft or hair follicles and punch on the baldy area and then transplant them. And it can be done in the OPD basis. Yes, people ask me sometimes whether the result will be permanent or the hair will fall, or if there is any maintenance for the hair transplantation. The result is permanent. Until before hair transplantation, we should rule out the patient's comorbidity or any pathological condition if the patient is having or not. If we find the patient is having no problem medically, we should go for it and the result is permanent. After once the wound is healed up, you can color it because the hair will grow up and they will have a chance to gray also if you are aged. So you can color it, you can cut it. It's your hair, the same texture and the composition of the graft will be same like other part of the scalp where it is there. Usually after hair transplantation, we put a surgical mask on cap on the patient's head and we ask the patient not to touch the hair transplanted area for 5 to 7 days because it is like a composite graft. So the newly grafted hair will get the blood from the new transplanted area. So if you move the hair transplant area or you shake it, the blood supply will be jeopardized. So after 5 to 7 days, we just give him a betadine bath or in normal soap water bath. After that, you need not to worry. Initially the hair shaft will fall for 1 month, then slowly from the root it will come out and it will give a good result. If you want to see a full grown result, you have to wait at least 8 to 9 months to see the result. And if you are interested and if you want to know more about hair transplantation, you should come and meet me in Jodhpur Park, Wizderm.